Hello friends. Today we are going to discuss about side effects of counseling. Also it can be considered as side effects of psychotherapy. I am Dr. Suresh Vadadmat, professor of psychiatry working at National Institute of Mental Health and Neurosciences, Bangalore. In this video, I'll be discussing about the negative effect, side effects, adverse effects, and worsening of symptoms during counseling or psychotherapy. What is the prevalence of the side effects or unwanted effects during counseling or psychotherapy? What are the domains which will be affected during counseling? What are the structured assessments that can be carried out to quantify these unwanted effects? What are the implications of knowing about unwanted effects and how to rectify them? Let's understand about counseling. As per American Counseling Association, it defines counseling as a professional relationship that empowers diverse individuals, families, and groups to accomplish mental health, wellness, education, and career goals. That means here, the therapist is helping the client to achieve some of the career goals, wellness, and mental health. That means the counseling should help everyone. Maximum, it may not help. Can it cause side effects? Can it cause worsening of symptoms? Can it has adverse effect similar to drugs? That means if you give medicine, it should cure or improve his condition. But as we know, medicine causes side effects, adverse effects. Sometimes the client or the patient may not respond to the medicine. Similarly, the counseling can cause side effects, can cause adverse effects, and also sometimes it may worsen the symptoms of the client. In this video, I'll be discussing about the side effects. Before we move forward, we need to understand about the two important ethical principles as a background for this video. As a counselor, you have two important ethical principles should be kept uphold. Of course, autonomy and justice is very, very essential. But for this video, non-maleficency and beneficency plays a crucial role. What is this non-maleficency? That means the therapist should do no harm. That means at any circumstances, he should not harm the client. That is first. Second one is beneficency. That means the therapist should act in the best interest of the client. Under no circumstances he should harm, and he needs to think about doing good to the client. But in counseling, sometimes the therapist may harm the client. That can be considered a side effect. It can be caused as adverse effect, or it may cause worsening of symptoms, or new symptoms can come forward. That means counseling has side effects and unwanted effects. So, my dear friends, to understand this, again, I would like to go back with regard to drugs or the medicines. Whenever we give medicine, that is counseling here, it has two effects, or maybe considered as three effects. The first one is when you give counseling, there may be no effect at all. That means when you are given a medicine, it may not work at all and there is no effect. That is one. The second one is, as you're given the medicine, there is a desirable effect. You are given a medicine for headache and headache has improved. Similarly, you have given counseling for depression and the depression has moved off or improved. That is the second. The third one is undesirable side effects. Undesirable effects means you're given a medicine for headache. Now, he is having loose motions. That means these unwanted effects. Similarly, in counseling, there may be undesirable effects. What are those? They are side effects, and there are some of them adverse serious effects. Side effects are predictable and easily be managed, whereas adverse serious effects are unpredictable and requires intervention to control them. I'm not the first person talking about this. In 1964, Talbot and his colleagues wrote an article, Some Anti-Therapeutic Side Effects of Hospitalization and Psychotherapy. In 1968, is psychoanalysis harmful? That means the researchers long back had discussed about this. It is not new, but unfortunately, many studies did not look into this. There are meta-analyses which try to look into the side effects. Hardly 20 to 30% of the researchers have looked into the side effects of counseling or psychotherapy. Remaining 80 to 70% just ignored about the side effects. For example, if the drug is in the market, new drug, everyone wants to know the side effects. Similarly, we have tried to hide side effects of counseling. That is not right. As a researcher, we should know what are the side effects. We need to improve our counseling techniques. We need to improve our training. We need to improve our competency so that the client is not harmed. That is the two important ethical principles we need to follow. So, these unwanted effects, side effects, have been reported 6 decades back. Unfortunately, the researchers forgot about this. Psychotherapy is often seen as a mode of treatment with good effect and no side effects at all. Sometimes, very few say here and there may be side effects. Hence, researchers have completely ignored about the side effects. Now let's understand what is the prevalence of this side effects, negative effects, or unwanted effects. The studies have said that the side effects or unwanted effects is between 3 to 15%. Some of the studies have said it may be 10%. That means it is equivalent to any other drugs, that is medicines. That means you cannot just give psychotherapy to everyone and everyone cannot do psychotherapy. That means you need to be qualified, you need to have competency, you need to have skills to do psychotherapy. Just from the having nothing, you can't do psychotherapy. You need to undergo training. Otherwise, you are going to harm the client. A paper from Crawford and his colleagues, they said 1 in 20 adults undergoing psychotherapy have reported side effects. This is as per National Health Services. From there, they said that 5% is the side effect. That too in NHS. Think about this. Research on positive effects are many. But regarding the negative effects, unwanted effects, side effects, adverse events, studies are very, very minimal. Further, Philip and colleagues have looked into various side effects. If the patient is admitted in the psychiatric hospital, the unwanted effect of psychotherapy is 60%. Whereas in psychosomatic hospitals, it is 45% have reported side effects. And in convenience sampling of psychotherapy, 94% of them reported at least one negative outcome or effect because of psychotherapy. The numbers are mind-boggling. Simple reason is we never thought counseling or psychotherapy causes side effect. Recently, there was a study by Strauss and his colleagues published in British Journal of Psychiatry. The title of the study is Negative Effect of Psychotherapy, Estimating the Prevalence in Random National Sample. This is a well-conducted study. They reported commonly reported negative effects are during therapy. Many of the clients said that they had unpleasant memories, 58%, unpleasant feelings, 30%. These numbers are from research. Another important study published in 2024, Journal of Contemporary Psychotherapy. The researcher Tim Balder and his colleagues published this. The title of the study was Side Effects in Psychodynamic and Cognitive Behavioral Therapy. Again, this study said that 33% of them reported at least one side effect. Now let's understand what are those factors which play an important role in negative impact of counseling or psychotherapy. This can be divided into four. The first one is therapist-related factor, client-related factor, family-related factors, and finally, social environmental related factors. Let's look into the therapist-related factors. Imagine therapist personality plays a crucial role. Unresolved trauma of the therapist. Therapist in his childhood has undergone abuse. He had been sexually abused. That trauma will play a role during this therapy session also. Further, what is the belief system of the therapist? What does therapist think about orientation? Does he believe in homosexuality, or he is homophobic, or regarding transgender? Imagine if he is a transgender phobic and he starts abusing the client, what kind of person you are? Or he is homophobic and he abuses the client. Imagine the client is going through a already difficult situation and the therapist starts abusing, or he starts doing conversion therapy. Now look at the boundary violation. There are some therapists may cross the boundary. The therapist may develop counter-transference towards the client. Further, what about the social, cultural, and religious beliefs of the therapist? If the therapist is a vegan and he starts saying to the client, you should not eat non-veg, it is wrong, it is morally wrong, religious, you are committing a sin, and he starts using strongly loaded words, it will harm the client. That means the client is already suffering because of various reasons, and now the therapist is also abusing. That means it causes side effects. Similarly, the client-related factors. Again, the client's personality. If the client is borderline personality disorder, paranoid personality disorder, narcissistic, obsessive-compulsive personality disorder, and they do not want to change, then there will be worsening of symptoms. They may challenge the therapist. Further, the transference of the client. Again, transference means the client's thoughts, emotions, and behaviors towards the therapist is considered as transference. Many a time, the client may do boundary violation. That means they start flirting with the therapist, becoming romantically involved, can also harm the client. Illness-related factors. If the client has severe schizophrenia, having delusions, hallucination, they do not trust the therapist. Or even delusional disorder, they do not trust the therapist at all. They are suspicious towards the therapist. That will further harm the therapy. Non-response to the therapy at all. The client does not want to do anything. He is not motivated to do therapy. He simply says that I have given money and it is the therapist's job to make me all right. My job is to pay money. It is the therapist's job to cure my illness. He may refuse to do activities of daily living. He may not follow the timetable schedule. That means abnormal sickness behavior can be considered as a side effect in certain counseling. Poor motivation, non-compliance to the homework, and also not knowing what is his role in the therapy or in counseling can also cause side effects to the client. Further, client's family-related factors. If the family members are highly critical, hostile, non-supportive towards the client, not accepting him within the family, not involving him in the family decision, taking decision proxy on behalf of the client, and many a time the family members do not know what the client is going through, and they don't believe their client or their ward has some problem, and they say, be strong, you are my son or you are my daughter, And many a time they start blaming the client, telling that you are the reason you are suffering from depression. You are the reason you have done this. Your personality is weak. You're not good for anything. These kinds of comments by the family can also worsen the symptoms of the client. And the fourth important is socio-environmental religious factor. Imagine if a client is going to therapy and his friends and his social circle says he's going for therapy. That means, or he may be a mentally ill. That kind of stigma and discriminating him can cause severe impact on the client. Paying capacity, if he's unable to pay and he goes into depression and he may not improve at all, or he improves very little. Further, he may have money but he does not have access to therapist. Therapist is far away and the therapist is not able to do online counseling. Many a time, they do not want to discuss with others because of various reasons. And if they don't get any leave, the client may quit the job to do therapy. Many a time, they may not be able to take up family roles and responsibility, telling that they are ill. Again, that is abnormal sickness behavior. Or else the family may not give him any responsibility at all. Insurance companies may refuse to give reimbursement, telling that psychotherapy or counseling does not have any effect or side effect, so we will not give anything. Many a time, talking to the opposite gender about their personal issue and family issue in certain religious condition, social condition is considered as a taboo. So that kind of socio-environmental religious belief system of the client or the therapist, imagine therapist believes that woman's head should be covered and he starts giving gyan or knowledge to the client. Those socio-environmental religious factors also will play a role. And many a time, the therapist may say, don't do any sin, the God will punish you, to a client who does not believe in God. Or they may induce guilt in the client. So such kind of therapy or counseling will harm the client. Now let's understand how to assess the domains. Though I have given you 4 important factors, let's look into those domains. First and the foremost, the domain you should know about is stigma, where the client stays or in which community he stays. How does he perceive about stigma and discrimination with regard to therapy, about mental illness? Further, misconduct of the therapist. Whether therapist is qualified, whether he's been earlier charged with misconduct, malpractice. The therapeutic expectation, the mismatch between the therapist role and the client's role. The therapist does not give explanation. The client does not know what is his role and responsibility. Non-compliance to the treatment by the client, not doing homework, and non-responsiveness, dropout. Many a time, the client may become excessive dependent on the therapist. In counseling, we need to empower the client so that it becomes autonomous and self-sufficient. But many a time it may go against. Emergence of new symptoms, worsening of existing symptoms, deliberate self-harm, suicidal attempt or death by suicide, relationship worsening with family members, with friends, or maybe in the occupational place. And socio-occupational functioning has to be considered when you are assessing for side effects, unwanted effects, and adverse events. If you look at the literature, again, the 4 themes comes across. The most common was the relationship issues when the therapy is going on or after the therapy is done. Invariably, dependency on the therapist, high intensity of dependence, high emotion overload, or else we can call it as severe transference by the patient towards the therapist. That is the first. Second one is emergence of new symptoms, worsening of symptoms, developing suicidal thoughts, deliberate self-harm, or else having bad behavior, stigma, going and using drugs, substance use, problem unsolved. no improvement, no response, persistence of old symptoms, symptoms deterioration, pressure outside the treatment, that is family tension, impaired social relationship. These are the domains or the themes you should know the side effects of counseling or therapy can occur. Now let's classify these unwanted effects. If you see in the top, unwanted events are there. One is caused by psychotherapy, another one is not caused by psychotherapy. Not caused by psychotherapy can be considered as serious external event that may be because of head injury after undergoing psychotherapy. That was an accident, a road traffic accident. So this is unrelated. That is autonomous event, nothing to do with psychotherapy. Second one is unwanted event because of psychotherapy. That can be no failure in psychotherapy, but the psychotherapy was done, but there are side effects. It can be anxiety, especially in ERP. That is, ERP means exposure response prevention, or else flooding. Anxiety is there. So, or worsening of relationship when you are doing family therapy. These are all side effects, but the therapy is ongoing, it is beneficial. The second one is failure of psychotherapy because of the malpractice or unethical conduct of the therapist. So these are the things which can cause side effects to the client. So these how we can understand unwanted events and negative events, and the negative events nothing related to psychotherapy, no failure of psychotherapy but side effects is there, and finally the malpractice because of the therapist behavior. So this is how you can understand about these side effects. Now let's look into this definition of various terms. There are 5 important terms you need to know. What is side effects? What is adverse effects? What is non-response? Worsening of symptoms? And malpractice by the therapist. The definition of is being defined in the literature done by Michael Lurdon, an important article which was published in 2013 in the journal Clinical Psychology and Psychotherapy. As per the unwanted event or negative event means all negative events that occur in parallel or in the wake of counseling. That means whatever negative outcome is there or negative event occurs during psychotherapy is considered as negative event. Then what is side effects? This refers to unintended, unexpected, psychological, emotional, and behavioral consequences that arise during or after treatment. Side effects are unintended. That means the therapists do not want it, but it has happened. It need not be harmful and usually does not require much attention. These are side effects. If you look at this, the signs of psychotherapy where the side effects are occurring: lack of clear improvement, therapy goes beyond expected 20 sessions, the client is not at all adhering to the homework compliance, new symptoms are coming, worsening of symptoms, relationship is breaking, especially the client and their family members, stigmatization by the family, losing job, unable to hold on to the job. So these are the various signs of psychotherapy side effects. What are adverse effects? Any negative, unwanted effect that is probably caused by the treatment, that is correct treatment, which are harmful, clinically significant consequences directly related to counseling, often requires intervention. Simple example is if the client attempts suicide or deliberate self-harm, or the client harms somebody else, which requires intervention, they are called as adverse event and they are directly related to therapy. Malpractice. Here, the therapist involved in boundary violation in simple terms. That is any negative effect that is probably caused by incorrect, improperly applying treatment. So, the malpractice completely based upon the therapist competence, the therapist behavior, therapist morality and ethics. Treatment non-response. That is lack of improvement during the therapy. In simple words, what is deterioration? Deterioration is worsening of symptoms during therapy or counseling. and it may or may not be related to therapy at all, but there is a worsening. So these are the various definitions you should know. But however, the therapeutic risk has to be explained to the client. That is, all side effects and adverse effects that are known for counseling should be explained to the client. Patient have the right to know about the therapeutic risk. If I undergo this counseling, what are the side effects? What are the adverse effects which may develop? For example, the client should know in exposure and response prevention, there will be severe anxiety symptoms will be provoked by not doing compulsion. Another example is if the client has social phobia, you are trying to do flooding. You need to explain the client what is flooding. During flooding, what are the symptoms can occur? Can we cover this anxiety symptoms by medication or by relaxation technique? So these kinds of discussion should occur. Explanation of the side effects, explanation of the adverse events to be discussed. For example, if a client is an elderly man and you are doing exposure and response prevention, his anxiety increases severely and he has a heart disease. If he develops an MI, definitely it will be considered as an adverse event, my dear friends. That means you can't blindly accept counseling is safe. Now let's look into the structured assessment of unwanted effects. There are many scales available now. One of the important article published by Phillips and colleagues in 2019 in the journal Brain and Behavior. The title of the study is Assessing the Unwanted Effects, a systematic review of instruments used to assess the negative effects of psychotherapy. So let's look into that. They have looked into various 8 different instruments. The first one they looked into is Vanderbilt Negative Indicator Scale, Unwanted Effects and Adverse Treatment Reaction Checklist, Inventory for Assessment of Negative Effects of Psychotherapy, Experiences of Therapeutic Questionnaire, Negative Effects Questionnaire, Unwanted Events, Adverse Treatment Reaction in Context of Group Psychotherapy, Side Effects of Psychotherapy Scale, Positive and Negative Effects of Psychotherapy Scale. These are the 8 scales the Philip and his colleagues evaluated. What are the benefits? What are the important usefulness of these scales? They have reviewed in this article. This is how they have looked into it. They have looked into whether these scales looked into stigma, whether they looked into therapeutic misconduct, whether they looked into deterioration of symptoms, quality of therapy, what is the therapeutic relationship, expectation towards the therapy. So there are various parameters was used to know about these 8 different scales which have been devised to know the negative impact of psychotherapy. Now let's look into the one of the important scale which I think, this is my personal opinion, is one of the best. Unwanted events and adverse treatment reaction. It is considered as UEATR checklist. Assessment of negative effects of counseling. In simple words is UEATR checklist. This is how the scale looks into it. The first column is unwanted event checklist or classes, whether they are present or not. What is the context if they are present? What is the relation? And what is the severity? If you look at the important first one, that is lack of clear treatment results, prolongation of treatment, non-compliance of the patient, emergence of new symptoms, deterioration of symptoms, negative well-being of the patient, strain in the patient-therapist relationship, very good patient and therapist relationship, strain in family relation, change in family relation, strain in the work relations, changes in the work situation, sick leave of the patient, problem in the extended social net, any change in the life of the circumstances of the patient, and stigmatization. These are the various domains to be looked into it. Whether they are present or not is marked in the second column. The third column looks into the what is the context when these symptoms are appeared. Whether these symptoms appear during the diagnosis, during the theoretical orientation, is it during the selection of treatment, or during the treatment procedure, or during the sensitization process, or during the desensitization process or disinhibition process, treatment effect, or during the therapeutic patient relationship. So, under the what context these side effects are seen. The fourth is relation. What is the relationship between the therapy and the side effects? Are they related? That means side effect and the therapy or the counseling, is it related or unrelated? Unrelated means one, two means probably unrelated, three is possibly related, fourth is probably related, and fifth is related. That is definite is there. And the final one is severity. Severity is based on how severely it is affecting. Is it mildly and without any consequences, moderate but distressing, severe in need of countermeasures, very severe lasting negative consequences, extremely severe requiring hospitalization or life threatening? This is how the scale is looked into it. So, my dear friends, this UEATR checklist is one of the fact finding checklist. As the name suggests, it's a checklist. Although it talks about severity, but using this checklist, you will be able to understand, yes, the counseling is going in the right direction. Even if it is going in the right direction, is it having side effects? How much the client is going through a distressing symptoms? Are they worsening of symptoms? So that the therapist can modify his therapy or can change the strategy, or else he may think of referring the client to the higher centers. Now, what about the effects of talking about side effects? Suppose if a client has come for therapy, should we discuss side effects or not? Recently, there is an important study done by Mushala and his colleagues. They published in 2023 in Acta Psychiatrica Scandinavica. The title of the study is Effects of Talking About Side Effects versus Not Talking About Side Effects on the Therapeutic Alliance, a controlled clinical trial. Here, monitoring and discussion of side effects does not worsen the therapeutic alliance, but it can improve the therapist-patient cooperation. That means this study came out and clearly said that by discussing the side effects of psychotherapy or counseling, it is not going to worsen. It may further improve the relationship. The client may start having trust. That means the therapist is talking about the side effects. He's not overselling it. Further, recurrently using these side effect scales, discussion, monitoring them, and discussing with the patient may help the client and also the therapist to analyze the problems. What are the implications of knowing about side effects, doing research in side effects of psychotherapy? There are important reasons you should know about the side effects. In 2025, recently, a research has been conducted and published by Honklumpi and his colleagues. And the title of the study is Negative Effects in Randomized Controlled Trial of Psychotherapies and Psychological Intervention, a systematic review, published in Psychotherapy and Research. This study clearly said that identifying and managing negative effects of psychotherapy and psychological intervention denotes a good clinical practice by the therapist. That means you need to know about side effects, you need to know about the adverse effect of psychotherapy, and you need to discuss with the client. Hence, by monitoring side effects, you need to know certain things. You need to take informed consent before doing therapy, explain about the possible therapeutic risk, possible side effects, possible adverse event to be explained. You need to have license to practice. You need to improve your competencies. You need to improve your skills. Without license, don't practice. Hence, my dear friend, we need to do research. in the area of unwanted effects of psychotherapy, side effects of psychotherapy, and also adverse events of psychotherapy. Hence, we have to focus on this. To conclude, my dear friends, psychotherapy is not free of risks. Counseling is not free of risks. There can be negative consequences. There can be unwanted events. There can be side effects and adverse events. Hence, although you have taken oath of doing counseling, not doing harm to the client, but sometimes counseling can cause harm to the client. Hence, you need to explain. You need to explain the therapeutic risk. Therapists can find it difficult to recognize side effect. Hence, you may have to use structured assessment scales. Therapists should always look for unwanted effects, monitor them closely, explain the client, prepare the client if there are going to be side effects. And also, in follow-up, please supervise. Please supervise whether they are developing side effects or not. By doing this, you are upholding the profession of counseling, building trust, and this counseling or psychotherapy will go a long way. Thank you very much for giving your valuable time. Stay safe.